Hey everybody, this is Dr. Novo again from the Lifters Clinic, coming at you from CrossFit BNA. So we're going to be covering in today's video improving the bottom of the squat position. Sometimes there could be some knee pain at the bottom of the squat, and that could be either if there's limitations in the ankle or limitations in the hip. So without further ado, we're going to get through this, and hopefully this can help some of you out there.
Many times when an athlete has knee pain, they're going to use more of a hip hinge pattern, allowing the knee to not drive as far over the foot. The issue with using too much of a hip hinge pattern is it places a lot more load over the low back as opposed to over the quadricep, where it's really supposed to be. Rather, using a small bracing technique and allowing the knees to pass over is what's appropriate. But working yourself up to this position sometimes can mean having to look at the ankle and as well having to look at any sort of underlying issues without the abdomen that may be playing a role, such as weakness in the overall abdominal muscles or low back. You can see here with the barbell out of the way, utilizing too much of a hip hinge pattern creates more of an anterior tilt. Yes, it allows your knees to not drive so far over your feet, but it can lead to other issues further down the road. So we really want to make sure we have an optimal amount of healthy knee flexion. So if knee pain is a problem for you at the bottom of the squat, that's what we're going to cover next. To ensure we have enough ankle dorsiflexion, let's go ahead and test this out. Typically, we're supposed to have almost a 5-inch overlay from our front of our toe to our knee. That would be a healthy amount. If we're unable to get into that same bottom position, let's go ahead and grab a plate and see if we can get into a more appropriate bottom end position of the squat with almost a near vertical end of the spine. This would allow us to understand that yes, we should get a pair of squatting shoes if you don't have one, or to start working on some ankle mobility drills. Now, one drill that is without question probably the best to get more end range knee flexion and as well ankle dorsiflexion, and to start getting the knee used to being in this bottom position without pain, is to do a bottoms up squat. So utilizing my hands behind my head in prisoner position helps to keep my upper back tight, and utilizing the ball and the plate allow me to start squatting with a target that I can contact. Notice that I allow my weight to shift forward, and that's important as you start to progress with this activity. I'll do it a little bit more on this one. Now that I've ditched the plate, I'm a little closer to the ground, and I'm in a more appropriate depth where I have the hip slightly below the knee. This will allow me to start learning how to accept load onto the knee, and as well start to create some structural change in the Achilles tendon for the back end of the calf or ankle if that's really the problem. But nonetheless though, squatting more will make you better at squatting, but it doesn't always mean that we have to do it with a lot of weight.
When attempting to improve knee flexion, a lot of times a hand wedge position can be helpful. Using a hand wedge, one can use the lower lever of the leg with hand to apply more overpressure. If there needs to be additional separation or tractioning to the knee joint to improve knee flexion, a small towel wedge can be used, and the same rhythmic oscillation can be applied. To progress, one can use the same towel wedge in an upright kneeling position to influence applying more body weight onto improving knee flexion. Notice how the toes are supporting the body weight, and over time applying more and more weight over top of the leg by leaning forward. Progressively, the feet can be dropped and the hands placed in front, and now one can apply a bit more force production onto the knee, eventually also leaning back. Progressively, the quadricep can also be now controlled eccentrically as the knee improves in overall range of motion to now provide some more motor control and or strength, pulling ourselves into knee flexion and extending ourselves out.
Please go ahead and like and comment. Comments really do help for me to know what it is that everybody wants to see. And if anybody needs any additional help, please reach out to me either via phone number, which phone number should be down here. You can give me a call, or on the website, www.liftersclinic.com. All right, take care, everybody. Have a good rest of your week.